Which cranial nerve is assessed by checking the sense of smell? Correct option is A. What is the correct method for auscultating lung sound? Correct option is C. A nurse checks the apical pulse for 1 full minute when the patient is. Correct option is C. A patient has a blood pressure reading of 160 by 100 mmHg. This is classified as. Correct option is C. What does the term cyanosis suggest during skin inspection? Correct option is B. A nurse uses the Snellen chart to assess. Correct option is D. Which of the following is considered a primary data source? Correct option is C. A positive fill test suggests. Correct option is B. The dorsalis pedis pulse is located. Correct option is B. Which type of assessment is done when a patient is admitted? Correct option is D. Which tool is used to assess the level of consciousness? Correct option is C. The term tachypnea refer to. Correct option is C. A patient report seeing halos around light the nurse should assess for. Correct option is B. If a nurse hears S3 heart sound in an older adult, it may indicate. Correct option is B. Which finding is normal when percussing the lungs? Correct option is C. What is the normal range for an adult oral temperature in Celsius? Correct option is B. A patient is in pain and read at 8 by 10. This is considered. Correct option is C. A patient radial pulse is irregular. What should the nurse do next? Correct option is C. A nurse auscultates a wheeze. This sound is caused by. Correct option is B. A patient report recent weight loss. What type of data is this? Correct option is B. Which pulse is commonly used during CPR in adult? Correct option is C. While examining a patient's abdomen, the nurse note absence of bowel sound. The nurse should listen for. Correct option is D. A patient say, I feel dizzy when I stand up. This may indicate. Correct option is A. To assess cranial nerve 7, the nurse asked the patient to. Correct option is B. The term hyperresonance here on lung percussion may indicate. Correct option is A. Which type of health history include question about allergies and medication? Correct option is C. A patient pupils are unequal. This is term. Correct option is C. Which term describe a yellow discoloration of the skin? Correct option is C. In assessment, what is the chief complaint? Correct option is C. Where is the point of maximal impulses normally found? Correct option is B. A bluish color of lips and nail beds is called. Correct option is B. Which method is best to assess for pitting edema? Correct option is B. When performing otoscopic examination in adult, the pinna is pulled. Correct option is A. A nurse document that a patient is altered and oriented X3. What does this mean? Correct option is C. Which sound is expected over the stomach during percussion? Correct option is B. A patient grimaces when the nurse palpates the right lower quadrant. This may suggest. Correct option is B. Which pulse site is used for Allen test? Correct option is B. A barrel chest is commonly seen in. Correct option is C. The normal capillary refill time in adult is. Correct option is B. When testing cranial nerves 2, the nurse assess. Correct option is A.